If you're experiencing shoulder pain daily, whether during workouts or simple movements like reaching for something or lifting your arm up, you're not alone. Shoulder pain can come from a variety of causes, and to make matters more confusing, their symptoms often overlap. In today's video, we'll break down the most common causes of shoulder pain, delve into the anatomy behind each one, and provide injury-specific exercises to help you on your path to recovery. Let's get started. Injury number 1, bicipital tendinitis. Bicep tendinitis refers to inflammation of the biceps tendon, specifically the long head that runs through the bicipital groove of the humerus. This tendon plays a crucial role in shoulder stability and movement. Bicep tendinitis, or BT for short, occurs when the bicep tendon becomes irritated due to repetitive overhead motions, heavy lifting, or direct trauma. This irritation leads to inflammation, causing pain in the front of the shoulder that may radiate down the arm. Activities like lifting, pulling, or even reaching overhead can exacerbate this discomfort. It is also very essential to distinguish between tendinitis and tendinosis. For those of you who are not really aware of the difference, tendinitis refers to the acute inflammation of the tendon, often resulting from a sudden injury or overuse. The tendon may appear swollen and red, and the condition is typically short-term if properly managed. On the other hand, tendinosis is a chronic condition characterized by degeneration of the tendon fibers without significant inflammation. It results from repetitive strain or micro tears over time, leading to a weakened tendon structure. Understanding the difference is vital as it influences the treatment approach. While tendinitis may respond well to anti-inflammatory measures, tendinosis often requires strategies that promote tendon healing and remodeling. So how do we diagnose bicep tendinitis? There are several clinical tests that can help identify this pathology. First of all, we got Yergenson's test, which is performed with the patient's arm at their side, elbow flexed at 90 degrees, and forearm pronated. The examiner will then resist as the patient attempts to supinate and externally rotate the arm. Pain localized to the bicipital groove suggests a positive test. The second test that I've selected is the SPEEDS test. The patient extends the elbow and supinates the forearm. The examiner resists as the patient elevates the arm against resistance. Pain elicited in the bicipital groove indicates a positive result. Keep in mind that these tests are not always 100% correct, but they are a very good guideline for you to get started.
When trying to rehab bicep tendon issues, you don't want to focus on the concentric contraction. You want to focus on the isometric and the eccentric loading of the tendon, because we're dealing with the tendon, especially for when we're dealing with tendinosis rather than tendinitis, because as we've said previously in the video, tendinitis is acute inflammation, whereas tendinosis is degeneration of the tendon, which means that you have to try and get the tendon to work rather than the actual muscle, because in this situation the muscle is not the issue. When you are dealing with bicep tendon issues, this is one of the best exercises you can do. So you're going to attach this band onto your foot, and then from there you're going to help yourself with the other hand to bring the injured arm in front like this. You're going to hold the isometric contraction for 10 seconds, and then you're going to let it go down for another 10 seconds. So this exercise is hitting the isometric and the eccentric phases of this very simple exercise. You are loading the biceps, but you're focusing on the actual tendon. So I'm not even going to do any concentric contraction, so I'm going to help my right arm with my left arm to bring myself up to this position. Now from here, it's a question of doing, for example, 3 sets of 10 seconds up here and then 10 seconds on the way down, so you can really focus on the isometric and the eccentric phases of the exercise, which is going to load the tendon. After that, you want to target different angles. So instead of just doing it in front like this, you want to go slightly diagonal, for example here, and that's putting more load into that bicep tendon. And then finally, you want to go sideways and then turn your chest facing forward like a lateral delt raise, for example. 10 seconds here, and then slowly releasing the band on the way down. This is a great exercise to target that bicep tendon. Another great way to load the bicep tendon during the isometric and eccentric phases is the Smith machine. Most people think like Smith machine is not something that you would use, but when it comes to training around injuries, it's actually a really good friend of yours, right? So we're going to use the Smith machine now. I've essentially locked it right about here. So the movement is going to look something like this. Focus on the isometric, like I'm doing there. And then I'm going to very slowly resist the bar on the way down. And that's the beauty of the Smith machine. It really allows me to do that and then stop here. So I'm going to use both hands to push the bar up, and then we're going to resist. But in order for this to be effective, you want to make sure that you load the bar. Now we've loaded the bar, with two 20 kg on each side. And I'm going to push up with both up to about there. This is pretty heavy for me to push with one arm. I'm going to resist there for 10 seconds. And then after that, I'm going to resist the bar on the way down. And this is where it's getting really, really difficult. This is a great exercise to work on tendon integrity, stability, and loading that bicep tendon without actually loading the muscle.
The rotator cuff comprises of four muscles: the supraspinatus, infraspinatus, teres minor, and subscapularis. These muscles and their associated tendons stabilize the shoulder joint and facilitate a wide range of movements. Injuries in the rotator cuff can result from acute trauma, such as falling on an outstretched arm, or from chronic wear and tear due to repetitive overhead activities. Research indicates that the supraspinatus tendon is the most frequently injured component of the rotator cuff. Its anatomical position makes it particularly susceptible to impingement and degenerative changes. What's interesting is that rotator cuff injuries can have overlapping symptoms with bicep tendinitis. Due to these overlapping symptoms, accurate diagnosis is crucial for effective treatment. First of all, we got the drop arm test. The examiner abducts the patient's arm to 90 degrees and then asks the patient to slowly lower it down. Inability to do so smoothly or experiencing pain may indicate a rotator cuff tear, particularly of the supraspinatus. The Ren test is where the examiner palpates the anterior margin of the acromion while passively extending and internally rotating the patient's arm. A defect that you can palpate or rent in the rotator cuff tendon suggests a tear.
Most rehab exercises when it comes to the rotator cuff are consisting of these type of movements. So internal and external rotation with the band. However, there is debate amongst industry professionals about how effective these exercises are. I'm personally not a big fan of doing this with bands. I also find the following exercises very useless. This is probably one of the most useless exercises that you've ever seen online. You've probably seen a lot of gym bros do this before their workouts. They probably think this exercise is going to generate a bit more strength when they're benching or whatever, but I'm going to tell you now, this is the most useless exercise that you can ever do for the rotator cuff, because it's not actually targeting the rotator cuff. I'm sorry, gym bros, but that's just a fact. We're trying to target the supraspinatus rather than the infra and the subscap. So in order to target the supraspinatus, we need to target abduction. So I'm going to put this band around my foot like this, and I'm going to have it behind my back. Now from this position, I'm going to keep my thumb pointing up towards the ceiling, the palm is pointing forwards, and so I'm going to take my arm into abduction. When it comes to the supraspinatus, it's the muscle that creates the first 15 degrees of abduction. Essentially, after the 15 degrees, the deltoid takes over, or should take over. If you really want to specify your rehab, you want to make sure you divide the movement up to that 15 degrees first of all, and then continuing with the rest of the movements up to about here. In order for us to target the supra tendon, we need to focus on the isometric and the eccentric aspects of the movement. So I'm going to grab my hand like this, and I'm going to take it up to about 15 degrees, and then I'm going to rotate my chest facing forwards. Now I'm loading that supra tendon here. I'm going to hold that for 10 seconds, and I'm going to very slowly release it down, focusing on the eccentric phase of the movement. You can also bring it up to about here, targeting that full length, 10-second hold, and then very slowly release on the way down. Now for most people, rotating the arm inwards like this is going to cause pain in the supra tendon. If you don't feel pain, you can also work in this position with pronation of the forearm. But if you do feel pain, you want to make sure you supinate and you work through these two ranges. One of the best ways to target rotator cuff stability and overall shoulder stability is the inverted kettlebell technique. So holding onto the kettlebell upside down like this is putting a lot of stress and tension through the wrist, elbow, and shoulder. Now there's a few variations you can do here. First of all is that 90-degree anterior hold like this, or you can start to move around through the angles like this. This is a great exercise because I can feel it straight away putting tension in my rotator cuff and my muscles starting to get fatigued. Now from here I can push up into a shoulder press and start to rotate the kettlebell in each direction. So you can do repetitions, or you can do the isometric holds like we've said, and the very slow eccentric loading, which is great for the bicep tendon as well as the rotator cuff muscles. One of the most common mistakes that people do when training around injuries is on the dumbbell shoulder press. Now usually I would go down to about here when I'm pressing, right? So you would do a full rep from here to about here without locking the elbows. Now, if you're injured, you don't want to go beyond that 90-degree angle, because this is going to protect your shoulder and allow you to still train without irritating the tendon. If you go down below this point, you're putting a stretch on the bicep tendon and you're pressing down on the supra tendon, okay, if we're talking about rotator cuff injuries. One of the best things that you can do is work at that 90-degree angle, and then from there up to about here, slowly on the way down, look yourself in the mirror, look at the angle of my bicep, triceps, and forearm. You can hold the isometric contraction there and then push up. That's the best way to protect yourself during any pushing movements. The same goes for dumbbell press for the chest, and the same also goes for any pulling movements. You don't really want your elbow to go beyond the midline of your body, and that's really going to protect your tendon.
Understanding the nuances of shoulder injuries is vital for effective management and recovery. If you're experiencing persistent shoulder pain, it's essential to consult with a healthcare professional for an accurate diagnosis and personalized treatment plan. Stay tuned for our next videos where we can go deeper into these injuries and others. Don't forget to like, subscribe, and hit the notification bell to stay updated.